Hello, everyone. We'll just give 3 more minutes for our participants to log in and join us. Thank you. Okay, I suppose we can start. So good day, everyone. I hope you are safe and well wherever you are in the world. To those new in the SIHI network, welcome. We are absolutely delighted to have you on board. SIHI, which we pronounce the SIHI, stands for Social Innovation in Health Initiative. We were launched in 2014 and dream of a better and healthier world through social innovation. So we do this through research, capacity building, and advocacy. And also, we welcome to those who are already part of this network, our various implementing partners, the university-based SIHI hubs, and our contributing partner. Thanks for finding time to join us. So I'm Art Ongkeko, co-leading the SIHI Network Secretariat with Dr. Meredith Labarda. SIHI Talks is a series of monthly webinars that aims to provide a platform for potential and current partners to connect with each other and find opportunities to collaborate. And in this edition, we will showcase inter-hub research on social innovation in health between the SIHI China and SIHI Philippines. In this collaborative research activity, they delve deeper into understanding the lessons of community-based service to strengthen the facility-based delivery. So to give us a brief overview or a glimpse of this social innovation, please watch the video.
We have a project from Zumaraga, Samar, where they use boats to refer high-risk pregnant women and other high-risk population groups or individuals to a higher tertiary facility because it's an island community. So the project is called the One Health Facility, One Health Boat project.
When I came to Zumaraga, I was surprised that it had no birthing facility and the facility-based delivery was just at 20%. We live in an island and we should have a facility where our pregnant could go to because there are times that it's really difficult to bring patients to the hospitals, which is an hour away. And so I asked the public health nurse to vacate her office and her office would be a birthing facility for the RHU. And then we realized that, yeah, we have the facility, but our pregnant don't have the means to come. When an opportunity came in 2012, we proposed for a service boat or a sea ambulance, wherein that boat would be stationed in our facility so that every time there is a need to refer a patient, we have a boat, we have a boatman, and we have a fuel, so that the patient could be referred in less than an hour. Unlike when we didn't have the boat, the boatman, or even the fuel, it would take as long as 3 hours before the patient could be referred. Then the dream to have a birthing facility in every barangay health station with a boat came into me. It was just a dream. I was just communicating my dream to my fellow doctors. I mean, I wasn't really thinking that they would answer all, but Sir Ron just said that, yes, we would give you 4 boats for your barangay health stations. And really, it changed the way things are going on in the island. Using the boats, and even the health workers would also use the boat to render services in their catchment barangays. It would entail also a lot of expenses. However, we have a possible source of income because every mother delivering in an accredited PhilHealth facility attended by PhilHealth accredited doctors, she is actually bringing 9,550 pesos to the facility. So that is actually reimbursement for the supplies that she used, and even a portion of it goes to professional fee for the staff. So it's actually an added bonus. This is sustainable because as long as we are bringing pregnant to deliver in our birthing facilities, we are also bringing more money to the facility so that we could finance more activities for the members, for the people.
Country.
All right, so to officially kick off this webinar, I'd like to turn you over to Dr. Joseph Tucker, the SIHI China Hub lead, who will moderate this session. Dr. Tucker.
Thanks, Art. It's great to be here. Thanks so much to everyone for joining us today. I'd like to just say a few introductory remarks about the importance of research, about how this sprang out of a cross-hub collaboration, and then also a little bit about sustainability. So first, in terms of research is really important within social innovation, that it's easy to have a program that's implemented, that does, that seems to work, but without the research to demonstrate that it works, it's going to be difficult for policymakers to advocate for scale up or to expand the program beyond the current, the sort of boundaries of how it was started. So I think research comes into play in a bunch of important ways in this example. And one important part is the SIHI monitoring and evaluation framework. And when Dr. Shan first started to sketch out a way to measure this boat project, we actually went directly to the M&E framework, and I put the link into the chat box for those who are interested. But this M&E framework provides some conceptual sort of ideas, some practical examples, some online resources. And I think M&E monitoring and evaluation is really a fundamental part of social innovation, and we need to think carefully about how we can structure research and really build it up within the hubs. But in addition to sort of building up research within hubs, we need to bridge hubs. And the research that you're about to hear about is a nice example of cross-hub collaboration that Wenjie worked both with our SIHI team in China, the SIHI team, and was physically in Manila and was able to visit Zumaraga and work with the SIHI Philippines hub. And bringing together hubs, I think there's really a lot of great, a really strong rationale to do this. And I was thrilled that Dr. Shan was successful in her application. And I guess the other part, just in terms of research, the other useful resource, our team, or the SIHI team, really put together a checklist. And Dr. Shan used this when she did the research itself. And I'm putting a link into the chat box for the SIFR research, social innovation research checklist. And then one final brief word on sustainability. This project that Dr. Shan worked on was supported by the China Medical Board, which is an organization based in China that supports a global health leader program. It's highly, highly competitive. So they only take the very best. And Dr. Shan applied for this program. She's a clinical pediatrician who works at the National Children's Medical Center and the Shanghai Children's Medical Center. So part of what she does is really clinical in nature. And then she's a very passionate advocate for left behind children and abused children, and has done really path-breaking research in these areas. And for the past year, she's been working on evaluating this boat project that we just heard about in the video, and using the M&E framework and using the checklist and thinking about how do we design a rigorous quantitative approach to evaluation, what are qualitative methods that we could use, and how could we bring this together in a mixed methods approach. And so she's also part of our SIHI Fellows program and has been helping with SIHI Fellow projects. So without further ado, I'd like to turn things over to you, Dr. Shan. Thanks so much for sharing with us your research findings today.
Okay, thank you, Drew, for your kind introduction. And it's really my great honor to have this opportunity today to share this study with you. And just as you've seen in the video, it's a social innovation in boat transportation in a remote island in the Philippines. And firstly, I'd like to have a brief introduction about the context. Zamboanga, it is a remote island in the Philippines, and it consists of 25 coastal villages and is classified as a geographically isolated and disadvantaged area in the Philippines. And there is only one birthing facility in the island, the main health center, and we also call it the rural health unit. And there are 4 barangay health stations in different villages. And because there is no paved roads connected different villages, so the only way of transportation between different villages from home to the health facility is by boat. And as we all know, the facility-based delivery is extremely important. It is a key intervention to reduce maternal and neonatal mortality rates. And it has been strongly recommended by WHO and the Philippine government. However, back to 2012, the institutional delivery rate in Zamboanga is very high. It's very low. In 2012, it was only 34.11%, and it's much lower than the national average. And there are several possible barriers in increasing the institutional delivery rate, like transportation, cost, and women's perception. And Dr. Katerina, she used to be the municipal health officer in the Zamboanga, and she initiated the health service boat project in 2012. And this project provided 4 boats to the 4 barangay health stations. And each midwife was in charge of 1 boat. And they can use the boat to transport the pregnant women from their home to the health facilities. And the midwives, as well as the community health workers, they can also use the boat to conduct regular community visits to the villages. So this study aims to have a comprehensive evaluation of this project. We intend to evaluate the intervention effects of the VOTE project on the institutional delivery rate. And we also aim to explore the underlying mechanism. So we adopted sequential mixed methods. For the quantitative components, we use the linear difference in difference regression analysis to test the intervention effects of the VOTE project on institutional delivery. We also use the rank sum test to compare the rates of institutional delivery between cyclone-affected and non-cyclone-affected periods. For the qualitative components, we conducted 2 focus group discussions, one's for the mothers and another's for the health service providers. And we also carried out 2 semi-structured interviews, one's for the vice mayor of Zumaranga and another's for the innovator of the VOTE project, Dr. Kat. And this is the theory of change model of the VOTE project. And you can see there are 3 main pathways that bring about the outcome. First is establish the health referral system. And second is provide community visits. And the second is staff training. And here are the results. First, this figure shows the trend of institutional delivery rate in Zumaranga as well as the entire Philippines. The black line is for the Zumaranga. You can see in 2012, the facility-based delivery rate was only about 34%. And after the implementation of the VOTE project, the rate increased dramatically. And in 2015, it reached higher than 90% and kept a very high level. And the orange lines for the urban municipalities in the Philippines and the gray lines for the rural municipalities in the Philippines. And we compared the increasing trends of the Zumaranga and the rural Philippines by using the difference in difference regression analysis, and the result shows significant. And this figure shows the institutional delivery rate, the monthly institutional delivery rate in Zumaranga from 2017 to 2020. And the green areas is the periods that affected by tropical cyclones. And we can see a slightly decrease of the rate during the periods affected by the tropical cyclones. But generally, it still kept at a relatively high level or above 80%. And here are qualitative results of this study. And we try to answer how the health service VOTE projects affected the factors that influence institutional delivery rate. And we used the existing framework that explain the factors that may affect the location of delivery. First, for the resource availability. Before intervention, the mothers reported difficulties in accessing a boat, and they also need to pay for the transportation. But after intervention, the boat is available at any time and it's totally free. And for the perception of delivery, both of the women's and the health workers, their perception have been changed a lot. They have increased awareness of the importance of facility-based delivery. And for the mothers, they know home delivery is now not allowed. And for the perception of quality of care, all of the mothers, they report received high quality care in the facility. And for the influence of social cultural context and care experience, there are two new things emerged. One is involvement of the community health workers. The community health workers become more motivated after the implementation of the BOAT project. And another is the relationship between the healthcare providers and the women. Before the intervention, the mothers have limited knowledge about how to access the facility. And there are also limited frequency of community visits conducted by the community health workers. But after intervention, the community health workers, they accompany the women to access the facility, and they also conducted a regular, frequent community visits. And we also want to answer how the health service BOAT project was implemented. And there are three categories. First is the operation of the project BOAT. The accessibility of the project BOAT is good. The BOAT is accessible to everyone, regardless of their economic status and political affiliation. And the usability of the project BOAT is also good. The BOAT is on standby 24/7 with a quick response. However, the long-term maintenance of the BOAT is not very good because the project BOAT's condition is deteriorating, and 2 out of the 4 boats have been damaged during the typhoon. And there are also lack of money to purchase new boats or maintain the old ones. And for the interaction with the community acceptability is good. The BOAT project is positively accepted by the women, the health staff, and the local government. And the community engagement is also very good. There are wide awareness of the BOAT project among the community members, and the nurses, midwives, and health workers are all involved in the BOAT project. And lastly is the interaction with the health system. The accessibility of the health service has been improved after the intervention. The project BOAT enables the community to get more health services and health education. And the community health workers, they also undertake training to be aware of the BOAT project and to obtain health-related knowledge. But the budget availability is not promising. The local government provides limited budgets for the BOAT project, and the process of the reimbursement takes time. For example, the boatman, he needs to pay for the gasoline first, and then he needs to wait for quite a long time until he can get the reimbursements from the local government. And the second point is the rural health unit, the health facility, cannot get funds from the field health now. The field health is the national insurance system because they lost the accreditation during the pandemic. And next is the implications from a research perspective, because for this study, it's a quasi-experimental design. We used national data as comparison, but for the future study, I think it will be better to compare the Zumaranga's data to the similar island municipalities without BOAT service. And second is additional process evaluation. can help to sustain the service. And from a program perspective, the development of the boat projects not only improve transportation to facilities, but also motivated and provided a way for health workers to provide more health services. And when we're carrying out social innovation in the Philippines, we need to pay attention to implementing the universal healthcare law of the country. Generally, the health service boat project has facilitated inclusive, affordable, and effective healthcare delivery, even in the face of extreme weather conditions. And challenges that hindered the project's implementation have been identified, primarily stemming from inadequate funding for the operation and long-term maintenance of the project boats. Lastly, I'd like to send big thanks to my mentors, Professor Joe Tucker, Professor Katerina Nono-Abiertas, and Professor Meredith Labada, and also to my lovely teammates and the SIHI Philippines and all the participants in Zumaranga. Thank you.
That was great. Thanks, Dr. Shan. Really excellent presentation. And I already see a question from Dr. Halpap in the chat box. Who else was involved in the research? Was Dr. Nono-Abiertas involved? How did you collaborate with the local folks?
Yeah, Dr. Katz was also involved in the research, and my mentors as well. Yeah, and of course all the participants, including the community health workers and the midwives, and some of the community members also involved in the research.
Yeah. Thanks. Does anyone have other clarifying questions before we go to the panel discussion? And actually, Dr. Lansing, please go ahead. I see your hand up.
Thank you, Shan, for that excellent presentation. I had a nice chance to meet Shan briefly when she was here. As you said in your conclusion, there should be a more awareness among social innovators about the universal healthcare law in the Philippines. And I was wondering, when you did this, whether you looked into the reimbursements of the Philippine Health Insurance Corporation on the maternal care package. It's possible that the lack of financing could be low reimbursement rates, which we have encountered in other health facilities. So I wondered in Zumarraga whether the reimbursement rate from the Philippine Health Insurance Corporation is really, 80 to 100%. Over, thanks.
And this might be a good question for Dr. Kat. I know she's very familiar, or maybe more familiar with like reimbursements, but Dr. Kat, what are your thoughts on reimbursements and how the finances of this work?
Actually, good evening, everyone. Can you hear me? Sorry. Do you hear me clearly? Okay. So actually, when this project was conceptualized in 2012, it was an answer to the call for the Kalusugang Pangkalahatan. You remember that, Dr. Lansang, in 2011? That was the first attempt to work towards universal healthcare. And during this time, it was to address health inequities, right? However, in islands, the GDAS, there was still
access to health facilities was still a challenge, or if it's available, it's very costly. So actually, that's why we came up with this project. We linked a birthing facility to communities through the boat. And it was sustainable before because PhilHealth was paying the facility. So our income, when we started like below 500,000 pesos, and we reached up to 1.5 million pesos per year. Because during those times, PhilHealth was still actively paying or reimbursements to health facilities. Actually, the challenges that were mentioned by Doc Shan earlier, it was brought about because of the loss of the accreditation of the PhilHealth facility. Since this was conceptualized before with the core component of having a PhilHealth accredited facility. But when it was lost, it caused a big toll to the project. And I would like to also emphasize that it was not just a boat project. It was a boat referral system. So there were components. So not just the boat, the health workers or the community people, they were in charge of the community. So they were the ones taking care or tracking pregnant, and they were the ones, the barangay health workers, who were bringing these pregnant to facilities. So they linked with their midwives and their boatmen. And when they were bringing pregnant to the birthing facility, they were bringing money because almost 100%, 90 to 100% reimbursement from PhilHealth during that time. Sadly, through the years, there had been changes in the policies, and it has become more difficult for rural health units in general in the entire country to receive reimbursements from PhilHealth. So it's not just a problem in the Sumaraga Island. Yeah. I hope I was able to answer the question.
Thank you. It also emphasizes that when we talk about social innovations, there is also the component of interacting with the health system as part of sustaining the innovation, because as you said, sometimes PhilHealth can be unpredictable in its reimbursements. So there needs to be some way around that, or also to improve that part of the system. Thank you very much.
Thanks, Marianne. We have a couple of questions in the chat box. A question from Samuel Mayeden, who says they appreciate the remarkable innovation and asking about, is there scheduled maintenance plan in collaboration with the local community to ensure sustainability of boat operations? Dr. Shan, do you know do you know how it works now, or? Or Dr. Kat, do you want to? Yeah, go ahead. If you want to describe how it worked when you were there, go ahead, Dr. Kat.
Yeah.
So when we start, is it okay if I answer?
Yeah,
or
yeah,
do you have an answer?
No.
Okay.
Go ahead.
So when we started this in around 2011 to 2012, it was purely funded by PhilHealth reimbursements. Well, I mean, like for the maintenance of the operations. But first, the boats were donated. The initial 4 boats were donated by CS Foundation through its partner UP Foundation. This project came about because of Unilab Foundation Leadership Group, which I am a member of, the UFLJ Bacau. So this was our community project. And then we were able to we were able to have these 4 boats that were donated to the LGU. The counterpart of the government was the salary of the boatmen, the initial salary of the boatmen when there was still no reimbursement from PhilHealth, and then the fuel. So they started like minimal allocation. But when it was earning much, all the maintenance of the boats, like the repairs, these were all financed by our income from PhilHealth. However, because I left Zumaraga in 2017, and it was also during that time that there had been policy changes in PhilHealth, so the income had started to go down, and so the challenge then was where to look for funds now that its main source could not be depended on, right? Because PhilHealth is no longer paying that well. And luckily, and because of the importance of having an accessible vote, the LGU was a sort of pressured to put funds for this. But however, because of the limited availability of funds in the government, they could only do much. But yes, initially they provided funds for the maintenance. And actually, for the past years that the facility is no longer receiving income from PhilHealth, it's actually the government that's financing for the fuel, for the repairs, minor repairs. However, they could not afford to replace all the boats that were destroyed. But it's important, I feel it's important to say that the government was able to purchase a new boat during the time of pandemic, because as a replacement, because they saw how important it was to have access to transportation. So they were able to produce another boat. Sometimes people assume that this boat project is just composed of the 4 boat projects, the initial 4 boats, but actually it's having the availability of these boats that are accessible and managed by health facilities. So it's not just the initial 4 boats. There were boats that were also added along the way as sort of replacement. But since they were not part of the initially donated 4 boats, sometimes people would say na it's not part of the project. But actually, it's the concept of having boats that are readily available, and then with a system that you could access fuel and the boatman at the time of need. So it was really the gist of the innovation. So it was not just this particular boat. I hope sorry, I had a long answer, but I hope it clarified.
Thank you, Dr. Kat. Thank you. We have another question from Dr. Alger about how there's a sort of permanent threat of typhoons and damage to the boats. Is there anything else that can be done to mitigate this risk? Dr. Shan, so go ahead, Kat. Go ahead.
Actually, it is one of the important learnings that we had, because before we didn't know that we needed to insure the boats, or if there's really this insurance company who would insure wooden boats. Because what is also unique to this project is we use wooden boats. It's the usual boats that are being used by community people. So it's not the usual expensive sea ambulances that were that are ideal but very expensive and difficult to maintain. And since I mentioned that like the boats that were shown in the video, it was a small boat, but we have a bigger boat that is meant for habagat days or the stormy season. But of course, we always ask the boatman if it's safe, because if it's safe to cross, because no matter how big your boat is, if the boatman says that it's difficult to navigate, we have no choice. We have to stay where we are. Yeah, so that's why we have to have backup plans.
Thanks.
And yeah, I wish there is a way of insuring the boats now, or maybe the use of what you call the materials that are being used in other areas. it's not wooden, but it's also not steel. I'm sorry. What kind of I forgot the term for that, but they're saying that it's
Fiberglass, maybe.
yeah, fiberglass. But
Hmm.
before, when we surveyed the boat makers before, it wasn't available yet in our community. And also this happened after Typhoon Yolanda or Typhoon Haiyan. So the boat builders were actually the survivors from Basay Samar. So it was also a way, I mean, it also helped the boats, also helped the boat industry in another municipality.
Hmm. Hmm. Yeah, that's great. We've already had a bunch of great questions, and I should have introduced her before, but we've already heard Dr. Katerina Nono-Abiertas is a municipal health officer in Motiong, Samar, and was previously in Zumaraga, as she mentioned, from 2011 to 2017. She's really the social innovator here, and the kind of the queen of the boat project, perhaps. And I had the pleasure of meeting her in person several years ago in 2019. And I think we've already heard about, from the video, we heard about how this all started. I'm interested, after a few years, the boat project stopped, and there wasn't the sort of boat project as it was formally organized stopped, but then facility-based birth rates, as you saw from Dr. Shan's data, seem to remain pretty high. I'd be interested, Dr. Nono-Abiertas, how do you explain this? Like, what happened? Do you think people, once they started going to facilities, they didn't want to go back, or what? Or do you think there was more capacity? Like, what was going on there?
Um, Actually, that's a very good question. And I believe that the boat was just an enabler. So it helped us initially to, like for me, to show to my staff that I really wanted to help them, for them to be able to do their duties, because they identified that the lack of boat was a major factor in their inability to go to the community. So when they said that they needed the boats, I did my best to look for boats, and then I provided it to them. And then when they were going to the communities, there were more interactions, and then the people started accepting that the new norm is actually delivering at facilities. So when you say delivering at health facility, it doesn't necessarily mean that it's exclusive at our birthing facility in the island, because there are also other birthing facilities, like the birthing facilities in the city, which is also an hour away. So it means that people are still delivering in health facilities, but not necessarily in the health facility of Zumaraga. So I think there was really this change of behavior of our communities. So, and I think maybe the 6 years that I labored on this project, that I spent in that community, actually maybe contributed to that change. Because when people really realize that there's really no where to go, and yeah, also the helots or the traditional birth attendants, they were no longer practicing. So they were no longer staying in the area. So actually they have no choice but to go through health facilities. And then people would always help. I grew up in an island, and when there's an emergency, it's the nature of the people in the island to help each other. So when it's the government, I mean, when the government is not able to provide this help, I mean, other neighbors, other community people would help, because they know that a baby should be delivered in a facility.
Yeah, that's a great answer. And I think there's sort of a strong community spirit, and it's sort of like they would, of course, the community would come together and make sure that essential services are provided, or that there's help for a pregnant woman to get to a facility. And Wenjie, do you have any other thoughts about how the facility birth rate would remain high, or how would you interpret that finding?
Basically, I agree with Dr. Kat. And what impressed me a lot is that one midwife mentioned in the focus group discussion that she now uses her own private boat to transport pregnant women. So I believe that building the good relationship between the health providers and community members, as well as getting the health workers more involved and motivated, it's much more important than solely providing boats. So in this case, the health workers are so engaged in the whole process that they are dedicated to facilitating pregnant women to reach the health facility. I think this helps to keep that high facility-based delivery rate. Yeah.
Thanks. Good point. I can see Dr. Kat agrees with you. One more follow-up question for you, Wenjie. When you went to the island to do this mixed method study, were there things that surprised you or things that were interesting, something that you didn't expect in your focus group discussions or interviews? Oh, yeah. Sorry, you're muted.
Yeah, sorry. Yeah, as I mentioned before, I was so surprised that all the midwives and the community workers were so engaged in this project. I feel it seems they are not only the beneficiary of this project, but also take ownership of the project. They are very actively involved in the whole process and they care about the outcomes. So, and I believe that this is the key to successful implementation of this project.
Mm-hmm. Really high level of community engagement and sort of participation. Yeah. And it sounds like that was the case from the very beginning, that like when Dr. Kat was first starting this, that there was really strong community buy-in. Yeah. And I guess, Dr. Nono-Abiertas, are there things about this project that you're more interested in, or things that there's a lot of, I could see how this is sort of like a passion project for you. You're excited about lots of different parts of it, but which part of this is most interesting or important for you?
When I left Zumaraga in 2017, so there were like 2 doctors who followed after me, and the third doctor, the current doctor is actually the third doctor. So there had been changes in the leadership of the rural health unit, and there was also a change in the leadership of the municipality, like the mayor. My mayor, when I was still working this as the municipal health officer, she came back, because when I left, she was no longer the mayor, and then when I was no longer there, she was again the mayor. And I think my realization, or my maybe important takeaway from this, is really it's the change health workers. When you said that there was a good buy-in from the community, actually at the start it wasn't like that. Even my staff, because they were used to a laid back life in the islands, they were really very resistant to change, and it really took a lot of effort for me to work on this staff, on motivating them. But what I found out is that having this enabler, providing them the boat, actually helped them realize that I'm really also serious in helping them. And when they realized that, they also started giving more of themselves, and then really becoming better health workers. So I think that's the message that I would like to leave all of you, that this boat project, is it safe to say that it was successful, or it's still successful? It's because of the people who are there, who are continually working against the odds, So even though there are many challenges in the different aspects of the boat referral system, but as long as we have this motivated, the organic health workers there who understand that there should always be a boat, because it's much more difficult for them if they don't have access to boats. So yeah, that's my my main message, I guess.
Thanks, Dr. Kat. And we have a question in the chat box from Dr. Sarah Alden. Have you done follow-up interviews with the women who gave birth to learn more about their perceived transportation and birthing experiences? If so, what did you learn and how did it inform program improvement? Dr. Wenjie, would you like to take that one?
Can I answer first? Is it okay? Well,
sure.
do you have an answer? Yeah.
Go ahead. Go ahead.
So there was a doctor who came after me who actually did a study about the boats, and I think I'm sure she did this interview with the women. There were reports that they wanted a bigger and more comfortable boat, because what we initially provided was just actually a small boat, because it's easier to maintain and less fuel consumption, and it's actually also safe to transport them. But I think if it would be possible, like, to design a better boat, wherein they will be more comfortable. And also, before, the push was for every barangay health station to have a birthing facility. But because of the difficulty of maintaining a 24-hour 7 birthing facility in every barangay health station, it requires a lot of health workers. So it's not workable. So though some mothers are clamoring that to have more birthing facilities nearer to them, it's just very difficult to do that, to manage, because funding wise, and really the health workers, because it takes like 5 midwives to run one birthing facility 24/7. So imagine if you have, like, you add more, then you would require more midwives, and that would be more impossible or more difficult for the local government unit.
Thanks, Dr. Kat. And we need to wrap up. This has been a really rich discussion, but just I'd like to give a final opportunity to each of our 2 panelists. Do you have one line message for the SIHI Talks audience? Is there, for a group that's interested in social innovation, what do you want us to remember about this boat project? I'll start with Dr. Kat and then go to Dr. Wenjie. Dr. Kat first.
Yeah, I guess I would like again to emphasize that it's a boat referral system. It's not just a boat project. And then there are many people involved in maintaining its operations. And then the key for its sustainability, at least in communities, is really accreditation with the Department of Health and the PhilHealth, because the government could not really afford to finance for all the fuel, diba? I mean, for every referral. But if this referral would bring money back to the community, then it is more sustainable. So since I'm no longer in the area, like for the past 6 years, I've been trying to reach out to them to really work on putting back this accreditation. Because if you have this accredited facility that is bringing money, things are a lot easier. Yeah, and innovation, well, when I did this, I wasn't really trying to make an innovation. I was actually just answering a problem in the community. And I'm very grateful with SIHI that they were able to identify and label it as a social innovation. But then I also have some sort of frustration because though I am a social innovator, I'm not an author, I'm not a writer. So yeah, I wish we could provide also more opportunities for innovators to really be part of researches. Because currently we have limited access to those. Municipal health officers like me in the communities are always just being invited as key informants. And when it goes on like for how many times already, it gets frustrating. But most importantly also, that when we have these innovations, I'm hoping that we could also bring back more to the communities. We could like offer more concrete help to the communities. We don't just need to recognize, we need to help also find ways to improve the innovation, because yes, we do need new innovations along the way.
Thank you. Thanks, Dr. Kat. Dr. Shan, any final words before Dr. Meredith wraps up?
Yeah, for me, I have two insights for this project. First is the involvement of the community is critical for the both projects, and I think it is also important for all the social innovations. And second is, I think one of the advantage of social innovation is that it always involves different stakeholders. And I think for this case, you see, for me, I can never design such a great both projects, but Dr. Kat can. So I think if in the future, if we want to design a good intervention, we need to especially involve the local people, the local ones. I think it's the key point to design a great intervention or a great social innovation. Yeah.
Thanks. And that's a really nice way to end. Thank you both so much. This was really rich SIHI Talk session, and over to Dr. Meredith for final concluding remarks.
Thank you, Dr. Joe, Dr. Wenjie, and of course, Dr. Katerina. This has been a very engaging and very interesting SIHI Talks. I think just three things before we wrap this up. I think one that came up was the importance of advocating for social innovations, just like what Dr. Lansang said earlier, that if you really want to integrate this into the health system, we need to interact with the health system. To do that is the second point, which is the importance of embedding research. We need to provide evidence for policy, and so that our decisions are also informed. And the third one is was beautifully said by Dr. Wenjie. So the importance of strengthening capacities through collaboration and partnerships, and especially engaging the most important stakeholders, the community people themselves. So thank you to this SIHI Talks, and thank you for joining us. Before I officially end this, we would like also to invite everyone to the next SIHI Talks, which is happening on September 29. So just the same time, it's 8:00 p.m. in the Philippines, 1 p.m. UK, and 8 a.m. ET. Our topic would be spurring social innovation at the regional level. So we have invited partners from the different WHO regional offices. So we hope that you can also join us in this very interesting discussion. Again, this has been a very interesting and very engaging SIHI Talks, and thank you very much for joining us. See you again in September SIHI Talks. Have a nice day, everyone.